If your baby is able to crawl up and down stairs, and you're concerned that your baby's not able to walk up and down stairs, and you want to start teaching your baby how to walk upstairs safely, then you're watching the right video. In today's video, I'm going to share with you when you can expect your baby to start walking up and down stairs developmentally, a couple of safety precautions that I want you to pay attention to, and the common mistakes that I see most parents making when they're trying to teach their kid how to walk upstairs. If you're new to my channel, my name is Charrick Gordon. I've been a pediatric physical therapist for over 25 years. I show proactive parents just like you how to use simple touch and movement to help your baby catch up and move ahead. But today's episode, like I said, we're tackling how to help your baby walk up and down stairs safely. Today's episode, we're going to cover how to walk upstairs safely. But before we get into the tactics and the practical strategies of how to help your baby, let's talk about when you can expect your baby to start walking upstairs. Babies typically start crawling upstairs around 1 year old. You can expect your baby to start walking up around 15, 16 months. And by the time your baby is 2 years old, they will be able to walk up and downstairs using what's called a step-to-step gait pattern. What do I mean by a step-to-step gait pattern? Baby will put both feet on each step. So one foot up, then the next foot up to that same step, and then repeat that process going up and until baby's all the way up the top of the stairs. So a couple of safety precautions you want to take when your baby is practicing walking up and down stairs, or your baby's crawling up and down stairs. You definitely want to have a safety gate at the top of the stairs to prevent your baby from falling down the stairs. I mentioned in the last video that I did about crawling up and down the stairs, your baby crawling up and down stairs, that once every 6 minutes a baby is admitted to the ER in the United States with some sort of injury that occurred on stairs. So it's very important and a big concern for parents. Of course, if you're feeling that way, you're not alone. So let's get into it. Let's talk about exactly how you should help your baby to walk upstairs. I'm going to be using baby Annie here as my little assistant, and we're going to take you through it step by step. So here's the first thing we want to talk about. We talked about gates, and we talked about needing safety gates at the top of the stairs and one at the bottom of the stairs. The next safety precaution you want to take is you want to make sure that you are positioning yourself when you're teaching your baby to walk up, that you are below your baby and you're between your baby and the ground at all times. So if you're teaching your baby to walk up, I want to see you here if baby is here. Before we get into the practical strategies, let's start off with a couple of the mistakes that I see parents make when they're trying to teach their kid how to walk up and down stairs. I will show them, and then I come back the next week, and then I ask mom, okay, show me what you've been doing with baby in terms of walking up the stairs. And I'll see mom do this. This is one mistake, holding baby's arms up above their head, too high. What this tends to do is to cue baby to lean backwards onto the parent and not lean forward, which is where you want baby to be, so that baby can take her body weight on her legs. The second mistake that I see is parents holding baby around their trunk with their parents' hands under baby's arms like this. This again leads to baby leaning backwards like this instead of leaning forward. And when baby leans backwards like in this position, you will notice baby's legs are out in front of their body. All the baby's weight is on the back, leaning back on you, and baby is really not doing any of the work in terms of getting themselves up the stairs. You're just kind of there doing all the work, holding them. So the very first thing you want to do is approach the whole stair climbing situation from a position where you know what you're going to do. And what I want you to do is practice leaning your baby forward. There is a little moniker that we use in physical therapy terms to help parents to remember, and that is nose over toes. It's simple, it's easy to remember. Keep baby's nose over their toes. What do I mean by that? I mean, when you have baby standing on the step and baby brings that first leg up, I want you to practice leaning baby forward so that baby's nose is over her toes. So how do you do this? Stand behind your baby. I like to encourage parents when they are teaching their baby to walk up and down the stairs to start off at the top or towards the top, about 2 or 3 steps from the actual top of the stairs. Put a toy at the top of the stairs to motivate baby to go and get her favorite toy. And do that, and then gradually as baby gets better and your legs get stronger, bring baby further down the stairs and walk up the rest of the way. And then when you're walking down, you're going to do the exact opposite. You're going to start off towards the bottom of the stairs. Same thing that I said when we were working on crawling up and down the stairs. So you're going to start off, I'm videotaping from the bottom of my stairs because I don't want to have the tripod on the top of the stairs. So start off with your baby. Let's say this is the step you're on with your baby. Just hold baby's hands, let baby hold your fingers, and you support baby's wrists, and just guide baby a little bit forward. Lean your body forward, lean baby's body forward, and cue baby. If you notice that you're just standing there and baby is not doing anything, lean baby over to one side. What that will do is shift baby's body weight, shift baby's center of gravity slightly, and make it easier for baby to pop that leg up. Now, a lot of babies will have a favorite leg, and they will start with that leg, the stronger leg, and start with that leg, and then push through and go to the next, to bring the lagging leg up to that step. And then you just repeat the process, lean baby forward, lean baby over to one side, and cue baby to lift that leg and bring it up. Now, a couple of things you might notice while you're doing this with your little one. You might notice that your baby tends to lead with the same leg most of the time, or sometimes with some babies all the time. In the beginning, when you are working on helping your baby to build up his or her confidence in terms of just mastering the process and the mechanics of going up the stairs, I don't want you to make a fuss about which leg baby is leading with, especially in the very beginning. Once baby is able to actually walk up the stairs with you, then we can start working on switching, alternating baby's legs and making sure that that weaker leg doesn't get left behind. Because what happens is if baby gets into the habit of walking up the stairs, leading with the same leg, baby will continue to make that leg stronger. And of course, the other leg is getting not that much of a workout and it's getting weaker and weaker. We don't want that. We want both legs to be balanced. Once you've moved on from those initial times going up and down the stairs practicing, I want you to start working on some techniques and some strategies to cue baby to alternate their feet between the stairs. This is how we're going to do that. Let's say, for argument's sake, the fact that baby's left leg is closer to the camera, we're going to say, let's say baby's left leg is the leg she likes to lead with. What I want you to do is have baby stand, take your left hand, put it on baby's hip, and give baby a little bit of downward pressure on that left leg, and lean her over towards her left side of her body. When you do that, it will cue baby's left leg to extend her knee, straighten that knee, and bear her weight on that knee on that leg, because you're giving her a little bit of downward pressure and you're leaning her body slightly over to the left side. As you're doing that, you can take your right hand, put it behind baby's right knee, and just go ahead and pop that right leg up, which of course would be the weak leg. and then shift baby's weight over to that right leg and cue baby to step through with the left leg. Of course, if baby's left leg is her favorite leg, most babies will probably do this once you go from this position here where you put baby's right leg up. You may find that you might need to give baby a little bit of support around the trunk, give her a little hug, a little squeeze around the trunk just to make her feel like she's wearing a little weight belt, and cue her to power through. If you need to give her a little bit of a boost or give her a little pat on her bottom to give her a little bit of boost and bring her up halfway to where she can power through that weak leg. And then most babies will automatically bring that strong leg up onto the next step. And so as you continue to repeat that process and you move forward with going up the stairs with your baby, continue doing the weight shift from side to side to side to side and make sure that that weaker leg catches up and gets some strengthening. I find that I've used the stairs for getting baby to learn how to go up and down the stairs, but also as a fantastic way to strengthen baby's legs. If you need to take a break in the middle of the stairs, I've found that a fun activity, not even so much of an activity, just kind of like a bonding moment between mom and baby or dad and baby, is take a break, stop, and just put baby to sit on the stairs next to you, put your arm around her, and just hang out there for a bit, take a breather, let her know she's doing a good job. This is hard work, this is tough stuff. And babies enjoy having that, doing this adult-like thing with an adult, with your mom and dad, and just hanging out on the stairs. Take a breather. For some kids, especially those with low muscle tone or hypotonia, as the technical name for it is, stair training can be a real struggle for them. And don't be afraid to realize that, okay, you know what? This is a process. We're going to have to do this multiple times until baby gets the hang of it. Okay? So let's do a quick recap. Don't let your baby lean backwards. It is about the most inefficient way to try to go up a flight of stairs. You want to make sure you are physically leaning baby forward and guiding baby forward. Remember, nose over toes. Remember that phrase, and that will guide you. Don't hold your baby under their arms. Don't put your hand in baby's back. If you put your hand in baby's back, it just makes them kind of lean backwards. It really does not help. And the next thing you know, you're kind of lifting your baby up the stairs, like, what am I really doing here? Those are the simple techniques that you can use to help your baby to walk up a flight of stairs. If you got value from this video, please like it, subscribe to the channel, hit that notification bell so you're notified whenever I drop a new video, and I will see you in the next video, which will be tomorrow. If your baby's already walking upstairs and you're able to walk up the stairs and you want to learn how to teach your baby to walk downstairs, check out this video. See you over there.